Page 1. Blood Sugar Solution, Mark Hyman, 2014. Find balance in your life and in your blood sugar with the easy-to-follow guide on leading a healthier life and being a happier person, perfect for anyone looking to take control of their body. In the Blood Sugar Solution, Dr. Mark Hyman reveals that the secret solution to losing weight and preventing not just diabetes but also heart disease, stroke, dementia, and cancer is balanced insulin levels. Dr. Hyman describes the 7 keys to achieving wellness: nutrition, hormones, inflammation, digestion, detoxification, energy metabolism, and a calm mind, and explains his revolutionary 6-week healthy living program. With advice on diet, green living, supplements and medication, exercise, and personalizing the plan for optimal results, the book also teaches readers how to maintain lifelong health. Groundbreaking and timely, the Blood Sugar Solution is the fastest way to lose weight, prevent disease, and feel better than ever. Introduction. 0.1. Diabesity, what you don't know may kill you. What's in a name? Insulin resistance, metabolic syndrome, syndrome X, obesity, prediabetes, adult-onset diabetes, type 2 diabetes. These are all essentially one problem. Some vary by severity but all can have deadly consequences. The diagnosis and treatment of the underlying causes that drive all these conditions are actually the same. Diabesity is a more comprehensive term to describe the continuum from optimal blood sugar balance toward insulin resistance and full-blown diabetes. If you answered yes to any of the questions in the quiz here, you may already have diabesity. Nearly all people who are overweight, over 70% of adult Americans, already have prediabetes and have significant risks of disease and death. They just don't know it. Even worse, while the word diabesity is made up of the concepts of obesity and diabetes, even those who aren't overweight can have this problem. These are the skinny fat people. They are underlean, not enough muscle, instead of overweight and have a little extra weight around the middle, or belly fat. Currently there are no national screening recommendations, no treatment guidelines, no approved medications, and no reimbursement to healthcare providers for diagnosing and treating anything other than full-blown diabetes. Think about that. Doctors are not expected, trained, or paid to diagnose and treat the single biggest chronic disease in America, which, along with smoking, causes nearly all the major healthcare burdens of the 21st century, including heart disease, stroke, dementia, and even cancer. But here's the good news: that there is a scientifically proven solution that I have mapped out for you in this book. Our current medical practice has not caught up with our knowledge. In 2008, the American College of Endocrinology and the American Association of Clinical Endocrinologists gathered 22 experts and reviewed all the scientific data on prediabetes and diabetes. They heralded a wake-up clarion call for individuals, the healthcare community, and governments around the world. One, their conclusions were as follows. 1. The diagnosis of prediabetes and diabetes is arbitrary. A fasting blood sugar over 100 mg/dl is considered prediabetes, and a blood sugar over 126 mg/dl is considered diabetes. However, they found these cutoffs don't reflect the whole spectrum of risk, including heart disease, cancer, dementia, stroke, and even kidney and nerve damage, which starts at much lower numbers most people consider normal. 2. The DECODE study of 22,000 people examined the continuum of risk measured not by fasting blood sugar, but by blood sugar after a big sugar drink, the best way to diagnose the problem. The study found that even starting at blood sugar levels that were perfectly normal, 95 mg/dl, There was a steady and significant risk of heart disease and complications well below the accepted abnormal of less than 140 mg/dl for prediabetes and long before people reached the diabetic cutoff of 200 mg/dl. Bottom line, even if you have perfectly normal blood sugar, you may be sitting on a hidden time bomb of disease called diabesity, which prevents you from losing weight and living a long healthy life. Insulin resistance is the major cause of aging and death in the developed and most of the developing world. This book will help you identify and reverse this explosive situation for yourself. It also lays out a comprehensive action plan for greater collective action to solve this problem individually and collectively by getting healthy together. Page 17.